Hello, my name is Lauren Deep. I'm a nurse practitioner student at Walden University. I'm here to present my week 5 discussion video. The patient I'll be using for this assignment is a 15-year-old Caucasian female who presented for interview with her biological mom. She complains of not being good enough or worthy enough. She says she's scared about life and her future. Her parents complain about everything she does. No one understands her. She's fearful, irritable. She states everything is just getting worse. She says she wants to be a good child, but she's never meeting her parents' expectation. She's not motivated to do anything at home. She has difficulty falling asleep. She wants to be in her room all the time. Her mom complains that she easily gets upset about everything. She gets tearful easily. She says her grades are very important to her and she realized she's having difficulty concentrating. In summer school, she had to do summer school because she fell sick during the end of the school term and she did not meet all her school requirements, so she has to do extended schooling, and she's complaining that she's afraid she might fail because she is not able to concentrate as she used to. She says her grades are very important to her. She says her best friend moved away to another town because her parents got a job and in another town, and now she's left alone, no friends. She's also worried about the school here, how the next school year is going to look like. She just feels frustrated. She says she has suicidal thoughts, but she has no plan or intentions to hurt herself. She says that she doesn't take drugs, she doesn't smoke alcohol, she's never used any illicit drugs, she doesn't take any birth control pills, but she's not sexually active. She has no other mental health condition or no other physical medical condition beside mono, which is now with her subside at the moment. She has a family history of anxiety and depression, and her mom also has a history of depression. We started this client with Zoloft 25 milligram by mouth daily, and the rationale for starting this is because Zoloft is an antidepressant. It's a selective serotonin reuptake inhibitor. This first-line recommended treatment for depression and anxiety disorders, and they have been proven helpful because they don't have all the adverse side effects that are common with other previous antidepressant medications like the tricyclic antidepressants. We are thinking starting her on Zoloft will help elevate her symptoms of anxiety, which she rated as 9 on 10, and she'll be able to concentrate. She'll have motivated to study because it will improve her serotonin level in her system. She was educated about the medication. She was educated about the side effects of the medication, to take it as ordered, not to stop the medication not to stop the medication without notifying the physician because of withdrawal symptoms. She was educated about headache, GI disturbance, somnolence, and sexual dysfunction, but which is not a big issue with this child since she's not sexually active or even have a boyfriend. But she was educated that the Zoloft may even cause worsening of anxiety at the beginning, and if any worsening suicidal ideation or thoughts occur, she should call and report to her doctor immediately. The parents were educated to come back after 2 to 3 weeks to evaluate the effectiveness of the medication. Another rationale of putting her on Zoloft instead of any other selective serotonin reuptake inhibitor was that her mom is currently on Zoloft and she says it's very effective and it is helping with her depression. So we think that putting this client also on Zoloft, since they are her first degree relatives, may also help with her symptoms, but it doesn't mean it is going to be like that. But we have to observe her critically for suicidal ideation and depressed mode. Thanks very much and have a blessed day. Bye.